Essential tremor is among the most common movement disorders, affecting 7 million people in the United States alone. It is characterized by postural and kinetic tremor in the upper limbs. This means that people affected by essential tremor experience shaking in their arms when attempting to hold a rigid pose or performing a precise movement. In severe cases, the tremor is so strong that the affected person is unable to perform essential daily tasks, such as eating and getting dressed. Although treatments for essential tremor are currently available, they do not adequately improve patients' quality of life due to harmful side effects and inconsistent effectiveness. New methods of tremor suppression which address these weaknesses are emerging from research in neurology and rehabilitation engineering. This presentation analyzes current research in these new tremor suppression methods and discusses the future of the field. Current treatment options for people diagnosed with essential tremor are limited to medication and surgical intervention. Many medications have been tested with tremor, but most of these display inconsistent results. The most effective medications have been found to work in only 50% of patients, and these patients only show 50% improvement. These medications also present a risk of mild to moderate side effects such as minor speech and movement impairment. Surgical techniques have proven more effective than medication, but they carry an increased risk of side effects. Deep brain stimulation is the newest form of surgical treatment for essential tremor. It involves implanting an electrode into a central brain structure called the thalamus, as well as implanting an electric signal generator into the chest. Direct stimulation of the thalamus inactivates the malfunctioning portion responsible for tremor. Studies have shown that deep brain stimulation consistently achieves a 60 to 90% reduction in tremor. However, this improvement is offset by a risk of mild to severe side effects, including cognitive deficits and permanent partial paralysis. Because of this risk, the procedure is performed only in cases of strong medication-resistant tremor. Clearly, the current outlook for essential tremor patients is bleak. The only options available to them are expensive pharmacologic or surgical treatments which risk potentially harmful side effects with no guarantee of effectiveness, or to simply live with their tremor, which could render them unable to care for themselves. This dilemma has prompted researchers to search for non-invasive alternative treatment for essential tremor which consistently reduces tremor without the risk of harmful side effects. Currently, the majority of research in this area deals with external stimulation, or stimulation entirely from outside the body. The end goal of these forms of stimulation is to design a wearable tremor suppression device that will allow essential tremor patients to perform normal daily activities without hindrance or adverse side effects. The human nervous system is incredibly complex, with networks of neurons connecting the brain to every part of the body. The brain receives signals from the body's sensors and sends signals to the body's muscles and other systems. To simplify things, we will focus on the connection most relevant to current tremor suppression research, that is, communication to and from the wrist muscles. There are various ways to activate the neurons which carry these signals, both directly and indirectly. The following methods of stimulation can activate neurons without penetrating the skin. First, electrical stimulation. Neurons communicate with each other via electrical impulses. Therefore, by passing an electrical current through the skin, we can activate neurons traveling from the sensors to the brain and from the brain to the muscles. This technique is called transcutaneous electrical nerve stimulation, or TENS, and it is commonly used by physical therapists and chiropractors for pain relief and muscle relaxation. Because motor neurons require a stronger current than sensory neurons, it is possible to activate just the sensory neurons without the motor neurons by applying a low-level electrical current. Second is vibratory stimulation. Muscles have sensors which measure stretch and tension. Their purpose is to cause reflexes to protect themselves from hyperextension. Some of these sensors are located in the tendon, and others are embedded in the muscle belly. Applying any force, such as vibration, to a muscle tendon stretches the muscle and activates these sensors. Third, tactile stimulation. There are many sensors embedded in the skin which detect different types of touch. Each of these sensors sends signals to the brain, where those signals are processed and perceived as touch sensations. Every sensory input to the brain is integrated into the motor outputs from the brain, so simple touch may cause changes in these outputs. Over the past few decades, much has been done to explore these alternative methods of tremor suppression. The following summary of current research shows that electrical stimulation is the most heavily studied of these methods, and it shows the most potential as a viable treatment. The information included in this report is taken from peer-reviewed journal articles found through an online database search of scientific journals. As previously mentioned, electrical stimulation can be applied at varying levels. Low levels will produce only a sensation of tingling, while higher levels will also cause muscles to contract. Various studies have been performed utilizing both low and high levels of electrical stimulation to test their effects on various forms of tremor. The earliest documented case study on tremor suppression through electrical stimulation took place in 1985, when two Italian doctors reported that TENS eliminated tremor and spasms in a patient with myoclonic dystonia, a disease similar to essential tremor. Although they did not give details about their method, their results showed that electrical stimulation was a potentially viable treatment for tremor. The first detailed protocol was published in 1992 by a group of neurologists and researchers. They used a method called out-of-phase muscle contraction. This involves measuring the frequency of the patient's tremor and applying a strong electrical current to alternating sides of the arm, thereby always stimulating the muscles that oppose the direction of tremor. Using this method, they achieved a 73% improvement for the essential tremor patients involved in their study. In 2011, an engineering research group used a similar method to achieve a 67% improvement in patients with essential tremor and Parkinson's disease. While these results indicate that out-of-phase muscle contraction is effective for tremor suppression, it requires a complex control system to maintain synchronization with the patient's tremor. This makes it unfeasible for a wearable device. In order to address this complexity issue, another engineering group used a similar method called co-contraction in their 2013 study. This involves using an electrical current to contract muscles on both sides of the arms simultaneously, so they work against each other. This technique achieved a 52% improvement in patients, and the system fit into a wearable device consisting of several armbands. However, a subsequent study showed that there were still more improvements to be made. In 2015, another engineering research group designed a new tremor suppression system using out-of-phase muscle contraction. Their patients complained that the electrical current was uncomfortably strong and that their muscles began to fatigue. This prompted the group to use the same control system to deliver out-of-phase, low-level electrical current which only activated sensory neurons without activating motor neurons. This produced a much more comfortable tingling sensation while achieving a 35 to 48% tremor reduction. This is currently the most feasible system for use in an everyday wearable tremor suppression device. Not all studies of electrical stimulation have achieved positive results. For example, a 2011 study showed that electrical stimulation caused a 23 to 32% increase in primary writing tremor. However, the majority of studies suggest that electrical stimulation attenuates tremor to some degree. Much less has been done to study the effects of vibration on tremor. Two studies performed in 1980 and 2006 reported that vibration of tendons in the wrist increased tremor. In 2002, a different study reported more mixed results with Parkinson's disease patients. This report stated that in some patients, vibration caused tremor to disappear. In others, tremor remained, and in yet another group, tremor was induced where it was not previously present. The results of these studies suggest that we do not have enough evidence to conclude whether vibration is a viable treatment option for tremor, and we must perform more research in this area. Tactile stimulation is a currently unexplored area of tremor suppression research. One study has shown that touch contributes to a reduction in postural sway and balance tremor, but a literature search of tactile stimulation and tremor yielded no results for research in relevant areas of tremor pathology. However, Dr. Stephen K. Charles, a professor at Brigham Young University who specializes in essential tremor research, has received anecdotal claims from essential tremor patients that wearing a tight-fitting sleeve on the affected arm can reduce tremor. This leads him to believe that various forms of tactile stimulation may have an effect on tremor. Based on the current research, electrical stimulation is the most promising non-invasive treatment candidate for tremor suppression, as most of the available studies on electrical stimulation report a significant reduction of tremor. However, two major deficits across all of these studies seriously limit the conclusiveness of this report. These deficits must be addressed in order to effectively assess the viability of external stimulation as a treatment for essential tremor. First, the sample size. Most of the studies included in this report deal with one or more forms of tremor. However, across all studies, very few essential tremor patients were examined. None of the available studies incorporates a sufficient number of essential tremor patients to achieve statistical conclusiveness for the general population of people affected by essential tremor. When a sample size is too small, any results may be coincidental or attributed to specific traits of the individual participants. Increasing the sample size to include many essential tremor patients in a single study will allow researchers to draw definitive conclusions about general treatments. Second, the breadth of stimulation parameters. In the current body of research, each study only tests a single stimulation configuration. This practice is equivalent to throwing darts at a dartboard, and while it may be convenient for initial studies, the range is too narrow to definitively conclude whether the treatments are effective. For example, applying a slightly stronger or weaker electrical current could greatly affect the amount of improvement. Increasing the range of combinations of various stimulation settings will give researchers a more complete picture of how those parameters affect tremor. The next step for research in non-invasive treatments for essential tremor is to address these two considerations. With increased awareness of the prevalence and severity of essential tremor, as well as the limited treatment options, there will be an increased urgency to refine these new treatments. Although this research is still in its infancy, we can expect to see major advances in the coming years. As these new treatments mature into actual tremor suppression devices, millions of essential tremor patients will receive renewed hope to lead unhindered and more enjoyable daily lives. Thank you.